You are watching a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 25 years, please visit www.apcho.org.
October 1st, 2013 marks the day in which healthcare providers and other agencies will begin enrolling individuals without insurance into health insurance exchanges as part of the Affordable Care Act. With less than 4 months away, these organizations, including community health centers, are putting into place outreach and enrollment programs to help ensure that scores of Asian Americans, Native Hawaiians, and other Pacific Islanders across the country can get health insurance. This podcast series, which will include perspectives ranging from federal agencies, healthcare provider staff, and policy advocates, will attempt to shed some light on the issues and challenges facing healthcare providers as they prepare for this October 1st enrollment deadline. In this first podcast, Soyong Harley, AAPCHO's policy analyst, will discuss some of the issues community health centers will be encountering in preparation for ACA enrollment, as well as some of the policies that are pending under ACA regulations. Chris, what are the key issues and challenges you see for community health centers with respect to getting patients enrolled in the health insurance exchanges under the Affordable Care Act, also known as ACA?
Well, I think that there are a couple of important things for community health centers to keep in mind as they are preparing to enroll patients. One is to recognize that not all of the health insurance exchanges or marketplaces are going to operate the same, since some are going to be federally operated and some are going to be run by the states. And so I think that it's important for them to be aware of how the particular marketplace that they'll be working in intend to provide contracts for the community health centers. And the other thing is to make sure that their patients are aware that once the Affordable Care Act begins and after they've enrolled in a qualified health plan, that they can still go to their local community health centers. It also means that community health centers will need to work with the qualified health plans that are part of the exchanges and marketplaces that they're working within, so that those QHPs also recognize community health centers as essential community providers. Right now, QHPs are not required to contract with an FQHC, but they are subject to what is called a network adequacy standard, which has standards related to ensuring enough essential community providers under which a community health center would fall are incorporated into their network. And then I think the last big item is to make sure that community health centers have a plan and have staff that are ready to educate their patients about what the Affordable Care Act is and what it will mean for them in terms of their access to health insurance and options for paying for the health care that they need.
Can you talk about some of the resources that are currently available to community health centers, and also talk about some of the policies that are still pending under the ACA enrollment regulations?
Sure. So I think that it's important that community health centers are aware that the U.S. Department of Health and Human Services fully intends for them to be key partners and players in helping with the outreach and education and enrollment of new and currently uninsured patients. Right now, the federal budget includes $150 million in funding that is targeted for community health centers to enroll new patients. And it's intended to help community health centers hire and train staff and conduct community outreach to reach their patients and other consumers with unbiased information about the health benefit marketplaces, the qualified health plans, Medicaid, and children's health insurance programs. In terms of policy, I would say that there are still some moving pieces. For example, we know that HHS doesn't intend to release guidance around what will be considered basic health plans until sometime in early 2014.
And what insight can you give to community health centers as they prepare for their own ACA outreach, education, and enrollment?
So for purposes of outreach and enrollment, I think it will be really important for community health centers to keep track and to document the types of experiences that some of their populations might be having as it comes to the enrollment process. So for example, I think that Asian American, Native Hawaiian, and Pacific Islanders, other limited English proficient, and immigrant patients might be experiencing particular nuances or delays in enrolling that will be important for the community community health center world to keep track of. So knowing who's being reached and who isn't, what information is available or what information is needed will be important for us to keep track of so that we can work with the administration to iron out those issues.
Chris Harley, thank you for your time today.
This podcast was brought to you by AAPCHO. Please join the conversation on our Facebook fan page at facebook.com/AAPCHO and tune in for our next podcast at www.apcho.org.